Okay. So we spoke about hepatitis from A to D. I gave you lots of assignments. Do you remember?
Yes, you asked us about which hepatitis that you get um after getting another type of hepatitis. Yes.
Hepatitis. Okay. Okay. So do you have an answer to that?
Yeah, it was hepatitis D. And they said when you
Okay.
it's B and D, that goes together.
Yes.
Yeah.
Okay. Okay. So when you have this information at hand and you know this information that we have just spoken about, if you are asked any question, right? If someone is listening to music, or when you have any question, okay, on the NCLEX, and it's asking you about this, I mean, you see, one thing that our sister said too, that we should also bear in mind is that, you see, I always tell you, everything I tell you is like sometimes from experience. Questions will not come like just for you to be able to figure out the right answer straight away. Your wrong answers too are well calculated. Okay, so that you have time to think about all of them very well. And every situation will be different. So don't expect what you see in your Q banks to be almost the same as what you see on the NCLEX. All right. Just learn the idea and learn the information that that question is telling you. And when you understand, I always um, rest on the fact that you should really understand the question before you. If you don't understand the question, you can't choose the right answer. Because if you misunderstand the question, your answer too will be there for you to choose. Okay. If you didn't get the question well, your answer too will be there for you to choose. And that's going to cost you, right? So from hepatitis A to hepatitis E, E as in elephant. To wrap up what we said on them, we said the hepatitis A is what fecal oral, right? And you can get them via contaminated food, water, and poor sanitation, right? And most of the times they are only acute. They give you only acute symptoms. What we mean by acute symptoms is you just have let's say liver issues. You can get those jaundice, um, abdominal pain and all of that. You can get nausea and vomiting. You can get all those things, but they are acute. They never become chronic. You see, this simple thing that I've said, you can get a very nice question on it. And if you don't know this information, you'll find yourself wanting. Okay. Do you know that we have people with like liver, I mean, chronic liver disease and the rest, and I mean, all of those things. So what you are saying is that normally with hepatitis A, they don't end up giving you chronic infections. They are mostly acute. Okay. As soon as the infection is cleared, then that is all. So that's fecal oral and poor sanitation. All right. And it also requires vaccine. We have hepatitis A vaccine there that you can take, right, to help prevent, vaccines help prevent infections. All right. So even if you forget everything, remember hepatitis A for anus. Okay. A for anus. That will help you maybe remember that it's fecal oral. Now to hepatitis B. Remember B, C, and D, they all have similar ways of transmission. Okay. And what is it? Like I, I told you previously that almost how HIV infection is being transmitted, they follow this, I mean, they follow similar routes of transmission. So think about blood, okay, through sexual contact, through sharing of needles, okay, perinatal. So anything that's, I mean, any way that you can get HIV infection. I'm using HIV infection as an example because HIV is it's well known. Okay, the mode of transmission and everything is well known. So I'm just mentioning it for you to be able to link it up in your minds. All right. So thinking of B, C, D, they are all blood-borne. And you can get them through sexual contact, needle sharing, or needle use with other infected people, perinatal, through perinatal areas and all of that. So just to let you know, and there's also a vaccine for it, right? Remember, for B, you can get either acute or chronic. Okay, if not treated well, it can be chronic. So people can live with hepatitis B for a very long time. All right, and remember, um, so not even you see, wait, let me coin this for you. HIV can be contracted through body fluids, right? So think of hepatitis B2 as body fluid. Okay, so anything body fluid, right? Okay, and it can become either acute or chronic. Okay, it can either be acute or chronic. Remember, we also mentioned the fact that newborn of newborns of infected mothers are given the hepatitis B immunoglobulin plus vaccine. Okay, HBIG. Yes, hepatitis B immunoglobulin with vaccine. Okay, within 12 hours. Someone said 72 hours, and I think we found out we realized it was 12 hours. Yes, and it's 12 hours. And I even said the earlier you get, the better. So just take note of that. Hepatitis C, that one to the same way you can get hepatitis B. All right, but hepatitis C is likely to become chronic. It's likely to become chronic. All right, and that is the type of hepatitis that is likely to get you to get liver cirrhosis. Okay, liver cirrhosis is very high when you have hepatitis C. And hepatitis B to hepatitis C is not that, the journey is not too long. It can easily advance. They are a group of similar causative organisms, so anything is possible, right? So when you hear of hepatitis C, think of chronic. And when it's chronic, that can lead you to get cirrhosis. And they are all C, C, C. So that's also the memory trick you can get over there, right? All right, then hepatitis D. Hepatitis D. You cannot get hepatitis D if you don't have hepatitis what? Can someone continue for us? If you don't have hepatitis what?
You
A.
cannot have hepatitis D if you don't have hepatitis B.
Yes. So it's like hepatitis D requires hepatitis B to survive. Okay. So you can't just test positive for hepatitis D without the presence of hepatitis B. That was what we said the last time. So take note. And remember, I've already said B, C, D, they all have the same route of transmission. Okay. So take note. So if that is so, then how can we prevent getting hepatitis D? Who can just guess?
Contact precautions.
No, when it comes to vaccines, like the prevention, like primary prevention. When we talk about primary prevention, it's more of vaccines. You know that.
So you get uh, Hep B vaccine,
Good,
vaccinated with Hep B.
good,
Yes.
good, good. So you see, this month you can get a very well-formed, nice English question here. Even though we are talking about hepatitis D, but if one wants to get him or herself protected from hepatitis D, So you see options like I can get hepatitis B vaccine. And if you don't know this information, it will be like we are talking about hepatitis D. So why should I even get hepatitis B vaccine? In fact, this is what you need. Okay. It is the hepatitis B vaccine you need in order to prevent you from getting hepatitis D. So just in case you meet it somewhere. All right. All right. Then the last one from D, you go to E, right? Alphabetically in order. The E, we said, the A and the E, they are the first and last, right?
Yeah.
And
And
they
they are in
all
the
have,
same class.
yes, they are in the same class. So hepatitis E2 is fecal oral. You can get it through contaminated water, food, and they are also, it's like how you get hepatitis A. It's mostly acute, so you don't, um, it's very rare for A and the E to get to become chronic. Okay, very rare. All right. So if you want to remember maybe some memory trick for hepatitis E, maybe you can say enteric. Okay, I think enteric too. Enteric is through your mouth, right? So hepatitis E, like through enteric means. All right. Then there's another thing. I just want to draw your attention to this. Um, when you hear of a pregnant woman, like I'm giving you some English tips, right? When the question is like you have a pregnant woman with severe hepatitis, it is likely, unless maybe they put you in a tight situation or they give you a nice scenario, but it's likely to be hepatitis E, like E for elephant. Okay. And the next one is when you have, let's say, someone who is an IV drug user. We have
Yes.
lots of people like that over here. IV drug user. Should a person get hepatitis from this or a practice? It's mostly hepatitis C. So when you hear IV drug user, it's mostly hepatitis C. Okay. Doesn't mean B2 you can get, but I mean we are talking about the most predominant part of it, all right? And when you hear of sexually transmitted, okay, or maybe perinatal areas, it's mostly or it's likely to be hepatitis B. All right. It's likely to be hepatitis B. And when you hear of hepatitis B symptoms worsening, what do you think you should have?
Please, can you come again?
Hepatitis D.
Yes, you should have hepatitis D. Someone said I should come again. On which one?
Before this one, the one you said before this one, the heavy issue.
Sexually transmitted.
Yes, please come again.
Yeah, so okay. So with sexually transmitted, like when you hear of hepatitis associated with like generally, okay, associated to sexually transmitted or perinatal areas, please think of hepatitis B first. Like if it's general, unless maybe you've been given a question that says otherwise, right? But this is general. You see, like once a time when I was telling you, when you see questions, let's say case study questions, and they tell you the patient is coughing out pink tinge sputum or frothy sputum. You remember I told you think of what?
Pulmonary edema.
Think of pulmonary edema, and it's always like that. That is one English trick. So this one too, I'm giving you this for, I mean, the types of hepatitis trick. Okay, unless they state otherwise, right? Okay, and the question I asked before our sister's question, when you have worsening, or when they tell you you have hepatitis B, which is worsening. So I was asking, what is likely to happen? Which type of hepatitis? Hepatitis D, right? Yes. And A2 is when they tell you there is food contamination outbreak and someone has hepatitis. Don't think that how can food examination outbreak cause hepatitis? What kind of hepatitis should you think about?
E.
Hepatitis
A or E?
A
Okay,
and
but
E.
E.
but think of A first. A for as in Albert. Okay,
Apple.
think of yeah A for apple. Yeah, think of A first before maybe E. Right,
Mm.
and please they will all show all those signs and symptoms of liver issues. Right, you have AST and ALT elevated. Please, if you don't know AST here, you should know and ALT. Okay, those are liver enzymes over here. Like you work with them daily. When you are working on your patient, you have to make sure that you know these values and you are looking at them. If you get a patient with liver issue and AST and ALT they are hyper elevated, you should know and you should understand so that you can adequately inform your healthcare provider just to cover yourself. Okay. All right. So AST, I think it's aspartate transaminase. We have two names for them, but one is aspartate transaminase and ALT is alanine or alanine
The
transaminase also.
alanine transaminase.
Transaminase, good. Okay, so they all get elevated, right? AST and ALT, they all get elevated. The necklace will not actually ask you of the value, but they'll tell you maybe elevated AST and ALT. All right. So just know that they are associated to the liver. Bilirubin too will be up. Maybe jaundice, that's yellowish discoloration of the skin, sclera, mucous membrane, wherever. Okay. Um, then you have what will happen to your stool when you have liver issues? How is it described?
gray.
Clay colored. Okay. Clay colored. So your stool, because of the bilirubin, your stool will look like a clay. So when you have clay colored stool, it's associated with liver. Okay. Then you have this fatigue. All right. I think
I have a
that is
question.
all for the record here. Is someone asking a question?
Yeah. The
Okay.
staturist. Can you hear me?
Yeah, we can. I can hear you now.
The staturist. So is it only in pancreas, or you can still find it as well in hepatitis?
No, in hepatitis you can find steatorrhea.
Okay.
I think it's more in pancreatitis because of the fat, And I think who can confirm? Can you find it in celiac disease?
Cystic fibrosis.
Yes,
Yes. Yes.
yes. Cystic
Exactly.
fibrosis you can find. Yeah, you can find that, and I think in celiac disease too you can find it. What's the difference between celiac and coeliac? Celiac disease and coeliac disease. What's the difference? Anyway, just try. They
Celiac
are the same.
is
Don't
yeah.
worry. Don't
Oh,
worry yourself. They are the same. Okay. I just want to save time. They are the same.
Are they the same?
ah,
So when you
you say
have
co
That
co what?
equally,
coeliac disease and celiac disease are
yeah,
the
one
same.
is American and the other
Coeliac.
is
They're the same
Coeliac.
One is American, eh?
But
thing.
please, I want to ask,
Uh-huh.
which one is the sprue? SPRUE.
The sprue.
celiac.
Okay, someone has answered that.
I didn't hear.
So the person says celiac. So celiac is a sprue. SPRUE. Those who are thinking or who are just imagining how it's being spelled. SPRUE. Sprue.
So the
Okay.
celiac is the same as the sprue.
Yeah, it's the same thing. Celiac. So either you see celiac disease, coeliac disease, or celiac sprue. Let me see if I can
Oh,
write it
okay.
here. Yeah, they basically talk about the same thing. Let me see. my pen here. So this is SPRUE we are talking about. SPRUE. Okay. So this is so whether you see celiac sprue, celiac disease, coeliac disease, they are the same thing. All right. That's just by the way. All right. So anything liver, think of clay callus too, right? We have other things we can talk about. I think it's a different topic. It's GI. Remember we have this ribbon like stool too. You know where you find the ribbon like stool? In what condition?
Hirschsprung's disease.
Hirschsprung's disease. Okay. Please, this is just by the way, okay. Uh-huh. All right, let us carry on. If you have any question here on what I've just said on hepatitis, you can ask. If you don't have any question, I have lots of questions for you. Let me clear my
I have a
board.
question.
Okay, please ask your question.
Do we manage all the hepatitis the same way?
Come again.
The management for the hepatitis, is it the same?
Oh, okay. Okay. Yeah, so management of the hepatitis, they are different, okay? They are different depending on what is happening. You know, how you manage the bloodborne hepatitis is different from how you manage uh, the fecal oral part, right?
The
So
food bomb.
if it's like prevention of hepatitis, okay, one, every prevention is vaccine throughout, so that is one. So what can we talk about the management when it comes to fecal oral, food hygiene, you know, proper
Drinking
sanitation.
water.
Yes. You see, so it's like prevention of the causes will give you the management, right? Prevention of the causes will give you the management. If it's bloodborne, those BCD, you prevent you prevent having unprotected sex. Okay. You prevent needle sharing. Okay. Anything that has something to do with body fluids mixing. Okay. Kissing can also be part of it. It's unlikely for you to get HIV via kissing. It doesn't mean it is entirely impossible. But with kissing, it's part of the ways to get it when you have hepatitis. I mean, with hepatitis, it's easier. It's saliva is body fluid. You know that it's parts like one kind. So I mean that is how it is. Please, have you been answered?
It's because I understand in hepatitis B at times we give these antiviral drugs for hepatitis B. That's how I was concerned about maybe hepatitis D and C. Do we still give the antiviral or it's only for hepatitis B?
Yes, so in all of them, you can give antiviral because the hepatitis itself, in that big caption, it's a viral disease. So you can't give any antibiotic, it's only viral disease. And most viral diseases, one, they clear off on their own. Sometimes with hepatitis A and E, sometimes, not all the time, but sometimes you don't even need an extensive antiviral medication. They can clear off. But when you have symptoms disturbing, it's antiviral medication. And it's the same. We can have different class, okay, but what I mean by different classes is like a different antiviral medication, right? But in all of the types of hepatitis, we use antiviral medications. Okay. So hepatitis B, C, D, you still need antiviral medications. And even with A and E. But the type to use will depend on maybe that won't be an advanced one. okay, for the pharmacist or maybe the doctor to know which one can target this kind of the groups which are causing what you have, because we have different strains of them. Okay. But in all, it's antiviral to treat all of them. Please, are you clear?
All right,
Prudential,
thank you.
you're welcome. Prudential, your hand is up.
Yeah, I want to ask that do you give this antiviral medication if the person is tested positive, or you give it if the person is tested negative?
So with negative, you are giving vaccine rather, so that we prevent it. If you test positive, people normally they give you depending on the severity of the infection, you might need both vaccine and immunoglobulin, okay, and antiviral medication. Depend on the infection, right? The extent of it. It's like when you have tetanus. When you are negative for tetanus, you are given a vaccine, right? But when you have the infection, they give you the vaccine and the IG. So the IG will fight against the active infection. Then the vaccine will prevent further worsening, or maybe if there are other strains that you can easily get, the vaccine will prevent that. So it's similar to hepatitis too. Okay, so when you are negative for hepatitis, what you can benefit from in terms of treatment is only the vaccine. You can't treat someone who is not sick, right? So if you don't have hepatitis, there's no point of getting antiviral medications. But when you are positive, that one is where you get the actual treatment. Please, have you been answered?
Yes, thank you.
Read
Yeah, well,
somewhere they were saying that even if you test positive for the hepatitis B, especially if the antibody is positive, it depends also with severity. They have to do the titers. If the titers, the viral load of the hepatitis is too high, it's when they put you on antiviral. But
good,
if it's too low, they just monitor you. And when so they are saying that they also do PCR for the same. So I think
good.
it's all
Yes,
depends on the
good.
severity of
Polymerase chain reaction. Good. PCR, that's polymerase chain reaction. Good, good. Do you work with them like in the lab or somewhere like that?
No, I've worked in this program to do with HIV and I've managed so patients with hepatitis as well.
Okay, good. Good. So thank you for sharing. So normally they will clear on their own. Okay. So like our sister said, if only the viral load is too much that your body can handle, then they will give you antiviral medications to uh, help you fight the infection. Okay. All right. Thank you. Any other question? Okay. So if no question, then I have a question for you. This is my first question. Can you still see my screen? Hello?
Yes.
Your screen have not changed.
I don't know why it wasn't showing. Okay, let me see. Okay, yeah. So this is my first question. Can someone read for us?
A child is receiving a series of the Hep B vaccine and arrive at the clinic with his parents for a second dose. Before administering the vaccine, the nurse should ask the child and parents about a history of a severe allergy to which substance? 1. Egg, 2. Penicillin, 3. Sulfonamide, 4. A previous dose of Hep B vaccine or component.
Mm-hmm. Who wants to try?
I think if I'll go for 4 because you have to find out whether they reacted, there was any reaction to the first dose.
The previous vaccine. Yeah, to me, 4 too.
Okay. Okay. I think that is correct. Who thinks otherwise? Who is thinking it could be a different answer aside for? Anyone here?
My otherwise is still number 4.
Okay. All right. So let me ask you a question. You remember I asked you, or I gave you an assignment that go and find out the types of live vaccines we have. Don't take the assignment on a silver platter. Maybe don't know where you will meet it, right? There is a kind of vaccine. If you are allergic to eggs, you can have it. What kind of vaccine is that?
Rubella.
Are you sure?
Yes, sir.
Rubella vaccine.
Are you sure?
Yellow fever.
Rubella vaccine.
Yes, sir. Rubella.
What other one do you know?
Influenza.
Yellow fever.
Please listen. Let me tell you something, okay? I think when you look at old English books, right? The MMR vaccine. When you talk about MMR, that is the measles, mumps, and rubella. So it's like 3 in 1 vaccine, right? Initially, when you look at very, very old English books, they will tell you that when you are allergic to egg, you can't have them. Okay. But studies have also proven otherwise, like latest updates or latest development shows that if you are allergic to egg or if you have egg allergy, you can still have your MMR vaccine. So just take note and do your corrections in mind if you've read it somewhere. Okay. So if you have
Sir,
egg allergy,
please come again.
okay. I know it's very new to most of you here. If you have egg allergy, okay, initially I think in the very, very old English books, they will tell you if you have egg allergy, you can't have MMR. So talking about measles, rubella vaccine, you can't have it because um it's mostly cultured in like chicken breast, something like that. It has something to do. The vaccine has something to do with egg because of how it's being cultured. So if you have allergy like to eggs, or if you have egg allergy, it was then known to be like you could also have an allergy to the MMR vaccine because of how it's being cultured. All right. But latest developments have proven otherwise, that it is safe for even those with severe egg allergies, not even minor ones. Even if you have a severe egg allergy, it is now safe for you to take MMR. Are we there? Yes. So you can check
So
CDC. I don't know whether you find it on WHO website, but CDC you can find it and other trusted sites. So that's the latest
so
development.
this one so this one that we were taught that for instance pregnant people, women of childbearing age, that they do rubella titer for them so that they can give them the rubella vaccine, and we should find out if they are allergic to eggs and those things. Doesn't mean it's insignificant. So such questions are
Yeah. So for now,
insignificant.
yeah. So for now, but please, the fact that they are live vaccines, it's a no to pregnant women. That is a different way of looking at it. Okay. If it's live vaccines you're talking about, people who are immunocompromised and pregnant women, don't it's a no-go area. Don't go there. That is a different thing to talk about than just allergy. Do you understand what we are saying?
Okay.
Okay, so if you are talking about allergies, allergies doesn't matter whether you are pregnant or you are not pregnant. And it, let's put the allergies aside. Can pregnant women receive MMR vaccine?
No.
No,
And the reason is that
No.
No, it's a live
It's
it's a
allowed.
live vaccine. Okay,
Right.
so that one alone is a no-go area for them. All right. So my back to my question, we've been able to disclaim the association of um, the MMR vaccine with egg allergy. So now, what is it now? During my research, I found something very interesting. So it's yellow fever vaccine.
Yeah.
Okay. Yes, you can do your searches and see. So if you have high or severe egg allergy, it will be unsafe for you to take yellow fever vaccine. So that is
Hey,
what I
you know,
found.
when we are going for a yellow fever shot, so they don't ask us, so, hey, what
That is
if
another
one of us?
story. Yeah, that is another
Atasa.
story to be talked about at another time. Yes. So let us take note. If you are if you have severe allergic reaction to egg, please don't go near yellow fever vaccine. All right. So that's just by the way, just to inform you. Okay. So yes, we are correct on this one. The answer is four. We can read the rationale quickly.
Contraindication to receiving hepatitis vaccine is a previous anaphylactic reaction to
So we
previous
didn't look at
dose
the question, no, say.
Oh, okay.
of a component.
Can we carry on?
Of allergic penicillin and prophylactic is unrelated
So
to
please, can I look at the
contraindication.
question?
Okay.
Can you go back to the question? Okay, thank you.
Okay. Mr. Hussein, your hand is up.
Please, sorry, not to send us back again, but then unfortunately, I think the previous lectures at that time I wasn't part of the class. So
Oh
about the
yeah.
hepatitis B,
Uh-huh.
the mode of transmission. I happen to, I mean, be at a unit that we always check for women, and that
Okay.
these women when they come, and most of them, in fact, most of them, they will be like they are aware of this particular infection for almost 6 years, 7 years. Um, they had it, but when you ask them to bring their partners or maybe their husband, you realize that most of them, in fact, most of the husbands don't really test positive. So I begin to, look at the possibility or how effective this could be transmitted through sexual means.
So it's like HIV. Sometimes it's like HIV. You can have someone, uh, you know, okay. So let's break down this one.
That
I
is
want to
so
start.
true, especially for pregnant mothers. It is very common. We have most discordant couples are the pregnant mothers. But
Okay.
I think there's a time we were doing a research on the same, and it was all about this thing. They were this discordant couple where they say they talk about strains that some people don't have the strains for HIV. As you know that the HIV, you have the CD4, it is the one that is attacked. And at the CD4, we have got the, what do you call them? When you are drawing
yes.
back in high school. So there are people who don't have that strain for the virus to attach itself. So for this,
Okay.
and another thing also, it's because for you to get HIV, unless you are not taking your medication or your virus is very high. Because sometimes if you are well lubricated and your partner is well lubricated, it is very hard. That's why they say HIV transmission nowadays sexually it is low than even the injection, because if all of you are well lubricated, it is hard because there must be what do you call it? Either friction or a tear at the skin. Then another thing, it is also that some mothers, they know their status early and start their medication very early, because you saw men don't go to hospital. That one we know. But the time a man goes to hospital, he is very sick. So, and these people, women, they tend to go to hospital. So we found that some women, they'll start their medication early, and once they are virally suppressed, they'll not be able to transmit to their husbands. So by the time if you get someone who is HIV positive, you have to probe. Some will even tell you, I started my medication long time ago, but because I didn't want my husband to know that I'm positive so that he doesn't leave me. So they take time by the time they come. But also there's that other thing of a discordant couple where they say some people don't have the strain for the virus to attach itself. But it's a whole story. But it's still there's no, I don't think there's a distinct answer to why we have so many discordant compounds, and to some extent it is mostly in pregnant mothers.
Yeah, I also learned somewhere that there's I don't know, somebody thought was teaching us. They describe it as if it's a gene that is not present in certain caliber of people. So where the virus is able to attach to, especially they say most that is very prevalent in Kenya. Most people do not have that gene for
Are
the
you
viruses
are
to,
are you
for the
mentioning my
viruses
did
for
you
the
say
viruses
cake?
to yes, for the viruses to attach to. So those people, even somebody who is infected can even have or sleep with them or those things, but because they don't have that gene for the virus to attach to, they will never get it. And that research was conducted among some prostitutes too, because they were found not to have it in spite of the unprotected sex with people who are infected, because they don't have that gene for the virus to attach to.
But also even the contribution in terms of anatomy, as women, we are more prone to getting these STIs than men because of our anatomy as well, and even our immunity.
Oh, interesting. So we have professors here. Everything I wanted to say in one way or the other has been said by our dear brother and sister. Okay, in different ways. So I don't know if we understand what they've just said. Um, the person who asked the question, are you answered, or you still need
She
more insight?
battle and arrive at the clinic with his parents for the second dose.
Mr. Jacob, are you reading to us? Anyone with any question? Okay, I think we are all clear now. All right. Thank you for your sharing. Okay, I mean, thank you that you've shared all of these things with us. Yeah. I wanted to start with even the anatomy part that our sister said, and I mean, speak about one or two things that they all said. But one way or the other, everybody has addressed whatever I wanted to say. So no repetition. All right. So this is my next question. Who can read for us?
The clinic nurse is assessing a child who is scheduled to receive a live virus vaccine immunization. What are the general contraindications associated with receiving a live virus vaccine? Should I read the possible answers?
No. Okay. So this is a SATA question. So I would want us to do it together. so that we don't spend much time on the select or that apply this. So let's do this together. Let's see. Sorry. Let me pick my mouse. Sorry. So the first one. Okay. All right. So the first one. The chart. I hope we all understand what the question demands, right? What are the general
Yes.
contraindications associated with receiving a live vaccine? So the first one is a part.
No.
No.
Why do you think it's not part?
Symptoms of cold. It doesn't weaken the immune system.
Okay,
So
good, good. What about two?
yes.
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 Two is
Two
part.
should be part.
Yes,
Good.
the
It's
two is
part.
What
part.
about three?
No.
No.
No, it's not part.
No.
Okay, good. So when you are alone and you are solving questions, if you want to know trick, learn tricks from what we do in life class. Okay.
Yes,
All
sir.
right. Option 4. Mm-hmm.
No.
No.
What's your
No.
reason?
A loss of appetite can be attributed to so many things.
To so many
So
things, not only yeah. So that's correct. What about 5?
yes,
Yes.
five
Part.
is
And
part.
what's your reason for 5?
People with deficient immunity is
Deficient
contraindicated to
immunity.
take live vaccines.
Good,
They have
good.
weak immune
Like they are
system.
weak, like
All
they are
right.
compromised.
Option 6.
No.
No.
Yes, option six. Yes.
Yes. Yes.
So if yes, why? If no, why? Some are saying no, some are saying yes. Franklin, start because you said yes.
To be exposed to an infectious disease, there are
No, we
several
have a lot.
infectious diseases and that can lead to weakening of the immune system. So I will go for six as well
Okay, so
because
fine.
that can also exacerbate the.
Okay, okay. Do you know? So those of you who want tricks, let me link something. So what's the difference between what Franklin is saying and option 1 that he himself eliminated?
The code is also an
The code was specific, but with
But
question number
but
6,
code,
it wasn't specific.
that can it fall under this one?
Kind
Yeah.
of. Yeah.
yes.
Yes.
So,
Yes.
so how do you relate it? It's like you hate palm nut oil, but you like red oil.
Or you like palm nut soup.
Yes, you like palm nut soup. Yes, that's what I wanted to say. You like palm nut soup, but you hate red palm nut oil, right? That is what Franklin is trying to do.
Eh.
So if 6 is part, then it means 1 should also be part.
Oh, okay.
Or you
But in the
or you
case
don't
of
agree with
one,
me.
it was specific. But in the case of
It was
six,
specific. Fine. So infectious disease, this one is a bracket of many. It can even be something
yes.
less severe than even cold. So how about that one?
And it can also be something more severe. Oh,
Yes. So it's a mixture of all of them, but you can't single this out as only severe.
okay.
So English question that have so this one is like an absolute. When you are taking your notes, okay, like skills in answering English question, you eradicate answers that normally concentrate on absolute, like all pregnant women are something, those all everyone, those kind of absolute. When I say absolute words, I hope you've met them before, you know what we are talking about. So it is like you are considering all infectious disease to be as such.
Oh.
All right. Yes, and
Only.
wait, and let me even ask you a question. Let's say what Franklin is saying is true. Who can give me any example of infectious disease? Any example apart from the code we have here? Who can give me an example?
Exposure to measles.
Measles. I want to link it. Okay, fine. I want to link it to something which is even outside
Hepatitis.
this. Okay, yes. So
Hepatitis.
let's say hepatitis. If I have hepatitis or even the measles that our sister mentioned, can't I get any live vaccine? Is that what you are telling me? Can't I get MRR vaccine? MMR rather. Measles, mumps, rubella. Can't I get MMR vaccine?
You can.
You can.
You
So
already have the
yes.
disease.
So you see the reason that Franklin is trying to give is still invalid here. The fact that you have measles or you have hepatitis doesn't mean your immune system is down to the extent that you can't receive this vaccine. And please, the fact that you have infection doesn't mean you are immunocompromised. Let's get that fact correct.
Yeah.
Look at option 5. Option 5 is different. Severely deficient immune system. That is different from if you have any infection, doesn't mean you are severely deficient in immune system. Do you understand?
Yes.
Okay. So the answers are what? 2 and 5.
Yes.
Do you all agree?
Yes.
Okay. So should you have met this question alone in your small corner? Will you score?
Yes.
Okay. Thanks be to God that you will score. Someone is shaking his or her head. Oh. Don't shake your head, okay? So this is the rationale to it. I have another one for you. Can we move on? Oh, I think that's all. So let's talk about this one.
There are now.
Okay. Can we carry on?
No, wait.
Okay.
Okay, thank you.
Okay.
Please, I want to see the question. Please.
Can you see the question now?
Yes, please. Thank you.
All right. So let's talk about meningococcal meningitis and its management. Okay. We are going to talk about lots of things here. Remember, I've already told you there are things which are not on this slide, but we shall talk about it as long as we are talking about meningitis, right? So with this infection, when you hear of anything like meningococcal meningitis, it's a bacteria. What is the causative organism for this?
Meningococcal meningitis.
It's Neisseria
Neisseria
meningitis. How do you pronounce that word?
meningitis.
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 What are we saying? Franklin,
Meningitis.
meningitis, right? Something like that. Yeah.
Meningitis.
Some say it's meningitis. Some
Meningitis.
say it's
Hey.
Meningitis.
okay. It's okay.
Bro,
So
no.
Meningitis.
those of you who are wondering where it is, here is it. I'm underlining it. Neisseria
Hey,
meningitis. So
yeah.
I don't know, however you pronounce it. Or meningococcus. Simple. So that's the causative organism for this kind of organism. And what they do is that they inflame the membranous covering of the brain and spinal cord. You know, the brain is there in the skull. being protected being protected by the cranium, and you have the vertebral column protecting the spine, which is the continuation of the brain. You know, the spine is part of the brain, not spine. Spinal cord rather. When I say spine, spine is bone, right? So the spinal cord is the continuation of the
Yes.
brain, which is housed by the vertebral column or the spine, right? We have meninges all over, right from the brain down through our back to the spine. Spinal cord, right? That is why if you have a severe injury at your back or anywhere associated to your vertebral column or your backbone, you have issues with your brain because it's the continuation of your brain. Okay, you have problems with movement and sometimes even with speech and lots of other things, depending on the area where the injury occurred, right? This one we are talking about is infection. So you can have the membranes that we are talking about. You know the membranes, right from the outer part to the inner part. Who can mention them? The membranes of the um meninges.
The dura mater, which is the outer, the tough.
Yeah,
Dura matter.
Then
What did you say? Dura what? Meta.
dura metals or metal.
Hey, Franklin.
then
Let us
the
see matter.
arachnoid,
Uh-huh.
the
Dura
arachnoid
metal.
mater, which is webbed, the webbed spider web-like structure, and then the
In the
inner
middle,
one
right?
is,
The pia matter.
yes,
Pia matter.
the
So
pia mater, which is the soft.
okay. So the pia matter is the one that is more closer to the brain and the spinal cord. Okay. So so it's like three layers, three in one layers that is covering the brain. When you have it being infected, that is what we, especially by this organism, the Neisseria meningitidis or
Meningitis.
meningitidis or something.
Meningitis.
Meningitidis, good,
Meningitis.
meningitidis. I think that is fine. So when you have it being infected by this Neisseria meningitidis, that is where you get this meningococcal meningitis, right? All right. Remember when we were doing those precautions, like isolation precautions, I made mention about meningitis, that they are caused by what? I mean, how do you get it? And what isolation precaution do you use? That is my question. If you remember, you
Droplets.
said
Droplet.
droplets.
Droplets.
Yes. Okay. So don't ever forget that. Okay, droplets. And when we say droplets, you know how we protect ourselves with regards to droplet infections. So we have surgical mask here. They should be in a private room, and whenever you are taking them outside their room, okay, to go for any procedure anywhere, you should give them mask. So you, the nurse, you can be in mask, but it's not necessarily that you should be mask. What is most important and what the entrance will test you is um the patient, him or herself, should be in mask. Okay, because let's say you are sending the patient to a different area and maybe through a hallway or something, you might meet anyone at all. You can't you can't protect everyone from the patient when you are moving the patient outside, right? But you can protect the patient from everyone. So that's the rationale for giving the patient the mask. And it's the same for people with airborne. Okay,
Mhm.
when you are moving them outside their room, you have to give them N95. So you see why we are talking about droplets. It doesn't mean when you get someone with, let's say, tuberculosis, and we are moving the person outside from his or a negative pressure room to maybe, let's say, an MRI facility to take MRI. You should know the kind of mask they should also wear. It is not necessarily for you, the nurse, to also wear N95 during transport. You can wear, okay, but the necklace will be more or let's say the NCLEX will target more on the patients wearing the N95 in airborne conditions when going out more than you, the nurse. So take note. When you are getting into the patient's room, someone with airborne, that one, the NCLEX will worry about you, the nurse wearing the mask, the N95. But when you are coming out, it's mostly the patients who should wear so that the patients can be, everybody can be protected from the patient. All right. So, how can we get this? Before we look at the rest of what we have on our slide here, how can you get this condition? It can spread through respiratory droplets, like we've said.
Sorry, sir.
Question?
Hello.
Yes.
Are you saying with patients with airborne infection, when they are going out, we need to give N95 or surgical masks?
N95 to them.
Okay, thank you.
Is it not a surgical mask they are supposed to
I
put
thought
on
so.
when
That's
they are
what I
going
know.
out?
That's why I'm asking.
Yes. Wait. Wait. Let us find out here. Is it N95 or surgical mask?
Surgical mask.
Surgical
The
mask.
surgical mask.
Thanks for the correction. Yes, it's surgical
You're
mask.
welcome.
It shows your students are doing well.
Yes, you
The
are doing well.
nurse
Thank
rather
you.
wears an
Yeah,
N95, and
when
the
going into the
patient,
room.
and
Good.
when the patient is being transported, the
It's
patient
just
wears
surgical
a
mask.
surgical.
It's true. Hey, today I like the
The
class.
last time you said it too,
I said this to myself.
but
Yes,
yeah, but you've changed
yes,
your
That's
mind.
what we
Your
know,
mouth.
but when they say we are
yes.
new
Thanks for drawing my
information.
attention. In fact,
Okay.
you are doing well. So thanks for drawing
Clap
my
for us,
attention.
clap
Yes.
for us, but yeah, clap for us.
Oh, I'll clap for you. I'll clap for you. So that's what you want, okay? Yes. So when going out, yeah, it's surgical mask. Thanks for that correction. Yeah. So it means you are listening. That's very good. Okay. So with the transmission, coughing, right? Sneezing, kissing. Okay. Coughing, sneezing, and kissing. And when you are in close contact, especially with this condition to in crowded areas, you can easily get.
So did you
So
say
take
Oh.
note.
kissing?
Yes,
Yes.
kissing. You can easily get. Okay. So either through respiratory, like anything that can spread respiratory droplet, like
What
coughing,
about laughing?
kissing, or laughing. Why you drew when you're
Ah.
laughing? or you see someone say ah. Franklin, you are warned. Okay. And please, this is where I want to draw attention to the crowded areas. Okay.
Okay.
Can you think of any crowded areas like college dormitories,
Like prisons.
prisons? Good. Military
Sports
barracks,
stadium.
good. Sports stadiums, military barracks, and so there's one common thing to daycare centers.
Yes.
Church.
Church. Church.
They
And then,
can test.
and when they are
Yes.
doing rally. Okay.
Rally. Okay.
Also
Yes. So
named
any crowded areas to place. That is not actually way that you can get, but it's like high risk settings. That's what I'm trying to say. Okay.
Mhm.
Those are high risk settings that you can easily get these infections from. Because over there someone is even like sneezing, coughing, talking louder, shouting with respiratory droplets all over, and all of those places. So
Say,
those are some of the settings you can get.
say, please, the casing, no, I want to clarify something. Is it like the saliva or because the person will come close to the infected person? That's how come they will get the disease.
Who can explain that? You know how casing is. I don't want to explain what it means to case here,
I think
right?
The
okay, try.
saliva.
The saliva exchange is one. Or are you talking about that peg? That's like That's that's fake. Like so kissing, okay. Kissing as in exchanging saliva.
Yeah.
Please, do you
Because
understand?
like when they kiss, like maybe they will swallow it, but not like breathing or something like that. So I want to
Oh,
know if
oh, okay.
saliva.
Okay, wait. So you mean the saliva will go into the stomach and the ACL will kill it, right? Is that is that what you're thinking? Okay, fine. So one, ACL doesn't kill everything. That is one. And also when you are kissing, you have nose coming together, right? If someone has the infection, it means the person can even be breathing directly onto you and you'll be inhaling. Do you understand that?
Yeah.
Yes.
Yes. So
Sir,
kissing is a
sir,
double double. I don't understand why people want you
sir,
to explain cases. You know what
sir.
kissing? Yes. Uh-huh.
Please, what about if the person is having a sore in the mouth? A
Okay,
sore.
so this one is not, please, this one is not
It's not
blood-borne
through
disease.
contact.
Like,
It's not through
Okay,
we are
contact.
talking about droplet infection, okay?
okay. Thank
Yeah,
you.
so it's not like HIV and all of those
Okay,
things. If it's
okay.
HIV, if it's HIV,
Yeah,
then it's no. You can't get it.
okay,
Please, let me explain this one to you. Even with regard to HIV, some sites will tell you yes, and it's yes unconditional. Okay, that is
okay,
if you have source. But generally, just kissing, if all memories are intact, you can't even spread HIV. But it is highly avoidable on the English world. Okay,
okay,
for English world, we don't take chances. It is like that breastfeeding thing we talked about the last time. If a mother has, let's say, if the mother has a low viral load and has been taking her antiviral medications, okay, in some part of Africa, you can breastfeed your newborn baby, but on the English world, you cannot breastfeed your baby.
no.
Okay, so things are different elsewhere. Okay, all
Okay,
right.
so
So yeah, so that's
Anything
what
else?
you've said. And what are the signs and symptoms you can get? I want us to finish this one. Let us wrap up this one, then I think we can go. Okay, so give us more time. Some of the symptoms you can get. You can get fever, right? Then we have some triad that you can easily get when it comes to uh, conditions of your meninges, right? Fever is there. You have altered mental state or level of consciousness reducing. Okay, so altered mental status is one, fever. Then the last one, who can tell me? It's very common among all meningitis. Who
Next.
can
Next
tell me?
stiffness.
Neck stiffness. Neck
Local rigidity.
stiffness. Okay.
Local rigidity.
Nuchal
Or nuchal
rigidity.
rigidity, yes. So if you don't see stiff neck and you see nuchal rigidity, it's the same thing we are talking about. So those are the three things you should never forget. But you can have
Can
other
you repeat
symptoms
it?
like severe headache. Okay, so the three main things are fever because of the infection, right? Altered mental status, they will be there. I mean, these things will be there. Fever, altered mental status, and nuchal rigidity, or the stiff neck thing we are talking about. Okay, so you see their neck very stiff. They can't just move their head. When you tend to move it causes a lot of pain. So they move.
Can next time.
Hold on, you get them. Okay. So other symptoms you can see is severe headache. Okay, and they don't tend. Who has seen this case before? They don't like light. Any slight light,
Yes.
Yeah. Yeah.
they become very irritable.
Yeah, their treatment is
Yeah.
more like tetanus.
Yes, it's like tetanus. How you treat them, and they don't like. I mean, they're sensitive to light and even sound. In severe cases, when they hear small noise, the noise aspect is more of tetanus, right? But in
Yeah.
severe
Mm-hmm.
form,
Mm-hmm.
yeah, in severe, like they are irritable to a lot of things, especially light. They are very photophobic. Okay, so we nest them in an enclosed place where there is no light. So as part of their management, just in case one day you should get a question on them, no light, okay, or you dim light, something like that. they have
Boss,
nausea and vomiting,
boss,
they are likely to have seizures. Yes.
can we also talk of non-blank petechiae?
That is a complication of it, and I think okay. So I'll talk about this later. Okay. The petechial rash or the peperic rash is not a normal sign and symptom. As soon as if you have someone with meningitis and you see a petechial rash or peperic rash, please, it's an emergency. You see small red spots on the abdomen or the chest or wherever, it means the infection has gotten into the blood and they are destroying the blood vessels. So they are making blood leak into tissues. That's what it means. Okay. Yes, I
So
wanted to talk. Come again.
can it cause DIC?
Yes, like you can get septic shock, and septic shock can lead to that, but not directly. Yeah, but in fact, severe infection, every sepsis can give you DIC. So yes, it's possible. Every infection, like severe infection, like septicemia. Okay, when we talk about sepsis, like septicemia, it can give you DIC. Like in all cases, can give you DIC straight away. So it's possible, and I think it's even a form of DIC. I don't know whether it's a form of DIC. Yeah, because you have the infection. I mean, destroying blood vessels and all of that, leaking blood under your skin. So back to the other signs and symptoms. Okay, we will cover all of those things, right? So think about confusion. So because the brain is involved, think about confusion, seizures, right? You can get seizure. Okay, and when you have seizure, you know the seizure precautions, right? You always have to keep the head end of the bed not above 30 degrees because of the changes in neurologic signs. You don't want to keep ICP high. When we say ICP, like intracranial pressure, you don't want to keep it high. So if you don't want ICP to be high, you keep head, for almost all neuro cases, out to about 30 degrees Celsius. 30 degrees high, not Celsius. Okay. 30 degrees high. Yeah. All right. And those seizure precautions, right? Side rails padding, suction,
So bad.
you remove all yes, all those things. You remove all harmful objects from
Positioning,
there.
should they be supine
No,
or
positioning
30
should be side.
when the client is having the
Okay.
seizures?
Yes, you shouldn't restrict the patient if the patient is in active seizure. You leave the patient because they're returning side and side and all over. Leave them, don't restrict them.
No, I mean like the position. Should the patient be flat or the 30 degrees that you were talking about during the seizure?
No,
During the seizure, I don't think you have a
during the
position for
seizure,
the
the
person during
position, yeah, the
seizure.
position is not. I'm talking about the position during the management, like normal management of meningitis. Okay, that is why we are talking about the positioning. But when someone is in active seizure, not everybody with meningitis will have seizure. Okay, but should the person have seizure, that is where you keep the person, like you institute the seizure precautions. And in that active form of seizure, there's nothing like, I mean, the person will even be flat. It's better to lay the person flat, okay, for whatever thing to happen. Or if the person is already in bed and the person is less than 30 degrees elevated, you can leave the person in that. Okay, just that you have to. I mean, the head of bed elevation is not actually part of the seizure precautions. That is just a general management.
Please,
The
but
actual
we see
seizure,
that. Sir, please, we see that one day, won't we put them on a recovery position like their other side?
yeah, that was what I wanted to say before that question came. Yeah. So
But
just
yeah,
when they are in active seizure, leave them.
but yeah, because I
You
think the
can't
recovery
position them
that you
when
are
they are in
talking
active
about,
seizure.
the recovery you are talking about is after the seizure, but
It's after
within
the
the
seizure
seizure, you
to
can't
prevent
give any
choking.
position.
Yes. Do you understand what we are saying? So in
Okay,
active
so
seizure, don't
during the seizure, we should leave them in any
leave
Yes.
them. Leave
Don't
them to
touch
do
them
whatever.
during
I mean,
seizure.
yeah, don't touch them. Leave them.
You just make
Okay.
sure there is
So all
nothing
that
around to harm them. That's all.
okay, good. All that you have to do is the seizure precautions. Okay.
Make the environment safe for seizure.
Thank you.
Okay,
Yes,
thank
that's what we are saying. Okay. So you pad in the process of having a seizure, or if even if sometimes you even prepare yourself before it even happens. In real life situations, if someone is on say someone has seizure precautions, when you go to the ward, you see that everything's already there. The side rails are already padded. So it's not when it happens before you rush and the person is a candidate for it. So you pad the side rails, then you make sure your oxygen and your suction equipment they are ready.
Monkasa ndamnameshia there.
You you referred you right. So you make sure everything is ready before. Okay. So when you have
Hey,
seizure
hey,
precautions,
that's a
okay. Any question on this one before we carry on? All right. So watch out for what my brother said. Okay, that's the next thing I wanted to talk about. Whenever the question starts like the person came with photophobia. This one can be a nice case study question. The person came with photophobia, um, very irritable to like confusion. Okay, very irritable and has altered mental state. So sometimes they can even hide the nuchal rigidity because they know you catch them, but they can give you other signs which are more common to I mean this meningitis. All right. If they tell you as a complication, maybe follow up question, the patient like which of the following should the nurse report to the healthcare provider as an emergent new sign or maybe as an emergent complication. Then you find something like a pepperic rash around the chest or the abdomen. And please, this is non-blanchable, doesn't blanch. Okay, when you press on it, this reddish thing, if they have this pepperic something and it blanches, it means it's already there. They have it already and it's not an issue. But if it's a new one, you press on it, it shouldn't blanch. Okay, and that could mean septic shock is in its way.
This say it
And
should
when
blanch, then blanch.
come again,
This say it should blanch or it shouldn't blanch.
it should not blanch, not blanch. So non-blanchable. Okay. If it blanches, then it could be something that maybe he or she already has. This pepperic rash or paprika rash should not blanch when you press on. Okay. So
Yeah.
if you see something like this, it could be a complication of the meningitis worsening, and probably it's linked to septic shock. It's an emergency. Please, it's not a normal sign. This is what we call emergency. Okay, you don't have to delay on this. How do we diagnose these people? Who can mention two common things we can do for them?
Lumbar puncture.
Lumbar puncture.
CT scan.
CT scan, good. And last one, who can tell me
P-
the most commonest one?
PPV.
Blood cultures. Yeah, it's an infection, right? An infection, so blood cultures too, so that you can know the competitive organism. Lumbar puncture too, you can culture the CSF, right? Yes, the cerebrospinal fluid, you can culture it to also know. And most of the times, please, in meningitis, the nature of the CSF is cloudy. Take note. Who has seen cerebrospinal fluid here before physically?
Me.
I think
Me.
it's more clear. It's more clear than water.
It's clearer than water.
The most the most clear. It's more than a crystal. Like very very clear than anything I've ever seen before. A pure
Clearer than
one.
water.
Like
Very clear.
yes. So it was wonderful. God is very wonderful, right?
Mm.
It's very very pure and clear. So when you take lumbar puncture and you see that it's cloudy, okay, especially in these people, then that is one sign. So the cerebrospinal fluid of these people, they are normally cloudy, right? And when they test, okay, for the CSF or they do CSF analysis, white blood cells in the CSF is likely to be high.
Yeah.
Proteins are likely to be high. Will glucose be high or down?
Low glucose.
It will be
It's
low.
supposed to be low.
Yes, it will be low.
Low, yes.
But normally, is glucose
Okay,
high
now.
or low in CSF?
CSF contains glucose, so it should be high.
High glucose.
Should
Yes,
be
there
high.
should be some amount of glucose. Okay,
Yeah.
but in CSF, sorry,
Yeah.
in meningitis, the glucose in the CSF is very very low than normal.
So now, okay.
Okay, yes, it's very low than normal. All right, then you have cloudy CSF, like cerebrospinal. All right. How do we treat these people with antibiotic, right? And supportive care. If they need oxygen, you give them oxygen. If they need fluid, you give them fluid. And seizure control is very important. And please, so there's one case rule about this. Okay, fine. Let me go up. Let me talk about the preventive way. Primary prevention will be what for this meningitis.
Sir, please, can I ask something?
Okay, so as someone is asking the question, think about my question too. Yes, ask your question.
Okay, so please, with the management, we mentioned that their intracranial pressure like goes up. Does it mean they have to administer mannitol to reduce it as part of the management?
It's mannitol is not a general. It's not part of the general management of meningitis. Okay, so we
Okay.
use mannitol in several ways just
Cerebral
to target
edema.
ICP. Okay, so it is not only for meningitis, and it will be at the discretion of the doctor. Sometimes they can even use hypertonic saline to treat. Okay, you know, hypertonic saline, like especially the 3%, can also target ICP and bring it down. Mannitol can also do. So they look at other things to happen because mannitol can also have a rebound effect. Okay,
Oh,
so generally it's not part of the management, but we know that mannitol and hypertonic saline, they are all used to manage ICP. That one is true. Okay, but they don't actually become the normal management. They don't form part of the normal management. Please, do you understand?
all right. Yes, thank you.
Yeah, welcome. Okay, so back to my question. What was the question I even asked?
What type of
Primary
isolation?
prevention, right?
Prevention.
Yes. So what's the primary prevention of it?
Nation.
Okay.
Oh, this should be
Vaccination.
common. It's
Both,
vaccination,
yes.
yes. Vaccination. When you have primary prevention, it's vaccination. So we have meningococcal vaccine, right?
Yeah.
Meningococcal vaccine that you can give to this person or people who are at risk, just to prevent them from getting right. Okay. Aside that, yes. What else haven't we talked about? So complications, someone has DIC can be part, okay? Um, anything, uh, anything about the brain
Hypertension.
too, it can cause brain damage, hearing loss.
Encephalitis.
Come again.
Encephalitis.
Good,
Possible or not?
good. It can lead to the
So,
inflammation
so
of the whole brain.
I have a question.
are you asking for complications?
Yes, we are talking about complications of meningitis.
Mm.
Okay, so it can cause hearing loss, it can cause the DIC, it can cause septic shock, it can affect your entire brain to be inflamed.
In children, cry can cause hydrocephalus.
Hydrocephalus is
Mm.
hydrocephalus is like a long
Migraines.
way.
Pardon?
That's what I think. It is possible, but hydrocephalus is like a
I
long
thought
way.
I saw one question and we were like one of the complications that the child is at risk of, and the child was having a meningitis and then some ear infection, and the
Uh-huh.
answer was hydrocephalus. So that was where I learned
Hydrocephalus. Oh, okay.
meningitis can actually cause
Okay. Okay.
hydrocephalus. Yeah.
Okay.
Good.
Okay. Okay. Yeah. Thanks for sharing. Okay. Yeah.
Mhm.
So if you say things concerning the brain, yeah, it can happen to the, I mean, it can occur. Okay. Those of you who know how hydrocephalus occur, it happens with regards to the ventricles, right? The the brain. We not go there right now. Yeah, so thanks for that addition. And then there's one thing as part of the signs and symptoms you see and management. Let's talk about these things and go and or maybe, no, I think we should talk about this tomorrow. Time is